So, Mark, we've been using the brain gauge to literally replace an fMRI and allow us to evolve our wellness protocols at Brain Mechanics for years now, working with populations like Alzheimer's, dementia, traumatic brain injuries, and things like this, and incorporating them into high-performing programs for athletes and others. And I'm really curious to understand, the history-wise, what is a brain gauge being used for? And what are the different applications and areas as a testing platform as well as a training platform?
Yeah, exactly. Basically, one of the big things about the brain gauge is that it's been used for a wide range of topics or a wide range of applications, both in basic research and in clinical applications. I mean, yeah, we started out just working with chronic pain populations. And, one of the things to point out here is that we realize that, when working with patients, you can't get a baseline measure. Like somebody walks in off the street from, they get in a car wreck and they come in off the street and they have pain problems or a concussion. You can't say, okay, we need to measure you a week before you got injured, which is what most traumatic brain injury measures rely on, a pre-injury baseline. We don't rely on that. So anyway, that was one way we got started in this, working with different patient groups such as pain and autism and traumatic brain injury groups. We work with we've got a lot of papers in the developmental disorder world, such as autism, ADHD, OCD, Tourette's. We've looked at, the brain gauge has been used for tracking and detecting aging and aging dementias and Parkinson's. It's been used a lot for just measuring anxiety and depression. I mentioned pain. There are many different types of pain, and looking at a big part of that is looking at acute versus chronic pain. At some point, when does acute pain become chronic? And that might not seem significant, but it leads to differences in treatment. In other words, if the pain is peripheral versus central, is the pain localized somewhere where you need to fix it, like in the arm or the leg, or has it become chronic and you need to fix it in the brain where the pain is? We've also done things like looked at different pharmacological insults, such as substance abuse and alcoholism, and done different kinds of drug studies. But the main thing to remember is what we're doing is we're not just tracking brain health. We're giving, clinicians are using this to give them guidance to see if treatments are working, if they're effective. And of course, we're also doing brain training. And I put the picture of the frog on here just to remind me that the boiling frog syndrome is something that's really critical. And a lot of clinicians we work with, they will test people who think, especially in the aging population, who think they're fine until they see their scores. And when they see their scores, they go, oh, maybe I do need help. And, anyway, and you've used this quite a bit in some of these different areas. And I wonder if you want to elaborate on that some.
Yeah, so for us, it's been a game changer, right? So we've been developing protocols for TBIs, Alzheimer's, dementia, long COVID, and all kinds of different conditions. And also that allows us to actually capture rapid changes throughout. So we measure on a weekly basis to see and trying different modes in what we're doing to see what works for people, right? We're really moving forward with the vision of smart wellness, evidence-based wellness. And, the brain gauge allows us to do that. But not only for different conditions that I mentioned, improving quality of life, but also as a performance platform. So right now we're working with athletes, professional athletes, Olympic athletes, high-level executives, people who really want to bring in their performance. And we're able to try very different things and measure the results of these things in a very, taking the guesswork out of optimizing their programs and brain functional performance. And one of the things that I love about the brain gauge is that range where you can actually apply it on an Olympic athlete, but also folks who have harder conditions. Like recently we were in Colombia and we had a client in the Cell Institute where she had an MS type situation. And it was just beautiful to see someone that normally these populations be hard to actually get a proper brain functional assessment, and within a matter of minutes, it actually helped to transform her life, because this person never played any video games at all. She couldn't play video games because of her condition, but I was coaching her and working with her. And initially she was frustrated. I literally had to put the fingers and the buttons to keep her going because her fingers would shift. But in a matter of minutes, she started getting it, and we started celebrating her success. And I could literally see this person's even confidence level transform from somebody who's just been in such a challenging condition to somebody who's going, wow, I played my first video game. Because for her, it was like a video game. It was a gaming experience where she's actually quite literally leveling up, right? Or another client who's got Lewy body dementia, very tart condition as well. And she's getting just fantastic results, because the part that a lot of people don't get about the brain gauge is actually works in the sensory motor reflex. And folks who actually have these conditions and you're using that path is actually going to help them. It's literally exercise equipment. And people talk about the mind and body connection, where the brain gauge measures that mind and body connection. You know, people talk about things like neuroplasticity. It measures neuroplasticity. People talk about neurological health. It actually bulks up neurological health. So for us, it's a no-brainer. And we feel blessed to have this as a platform, and blessed to have you guys as our partner on this journey. So, you know, I'd encourage anyone to really give it a test drive and kick the tires on it, and see what it does, because it's ultra sensitive, and it really, really takes the guesswork out of optimizing any of your clients' health and wellness protocols.
Excellent. Thank you.
All right.